Did you know that overgrowth of your cockatiel's beak can be a sign of nutritional deficiency? In this video, we will show you how to identify this problem and what to do to ensure that your bird has a healthy and happy life. Discover the key nutrients your cockatiel needs and how to avoid serious health problems. Don't miss out on these valuable tips. More than 90% of health problems in birds can be the result of nutritional deficiencies. The overgrowth of the beak particularly can be due to a lack of calcium and vitamin A. These nutrients are essential to maintain the health of the bird's beak, bones, and feathers. When there is a calcium deficiency, the beak can grow uncontrollably because calcium is essential for its mineralization, in addition to contributing to the bone structure of the cockatiel. Without the proper amount of this mineral, the nozzle does not wear down as it should, and over time it can become long and irregular. In addition, a lack of vitamin A can cause problems in epithelial tissues, such as the beak and the skin around it. Hypovitaminosis A, or vitamin A deficiency, leaves the beak dry, flaky, and prone to abnormal growth. This problem also weakens the cockatiel's immune system, increasing the risk of infections that can further aggravate the beak situation. To avoid these problems, it is essential to offer a balanced diet, including quality seeds, extruded kibble, and a variety of fruits and vegetables rich in vitamin A, such as carrots, squash, and leafy greens. If necessary, supplements can be introduced, but it is important to do this under the guidance of a veterinarian specializing in birds, ensuring that the bird receives all the necessary nutrients to maintain the health of the beak and the entire body. This overgrowth of the beak can also be related to liver disease, a serious problem that affects the bird's overall health. The liver plays a vital role in nutrient metabolism and detoxification of the body. When the liver is not functioning properly, the cockatiel's body may not properly metabolize the essential nutrients to keep the beak healthy. This can lead to abnormal beak growth, as well as other symptoms such as apathy, loss of appetite, and changes in the appearance of the feathers. Liver diseases in cockatiels can be caused by a variety of factors, including high-fat diets, infections, toxins, and even genetic predispositions. Poor diet, especially excessive consumption of oilseeds such as sunflower, can overwhelm the liver, resulting in conditions such as hepatitis. When the liver is compromised, the body's ability to process and eliminate toxins is reduced, which can directly affect the growth of the beak, resulting in deformities or overgrowth. Diagnosing liver problems in cockatiels requires a detailed veterinary evaluation, often involving blood tests, X-rays, and ultrasounds. Treatment will depend on the underlying cause and may include dietary changes, medications to support liver function, and in some cases, surgical interventions. Therefore, if your cockatiel's beak is growing abnormally, it is essential to consult with a veterinarian who specializes in birds to investigate any potential liver problems and take the necessary steps to treat the bird properly. The lack of natural wear and tear is also one of the factors causing this change. In the wild, cockatiels constantly use their beaks to forage for food, gnaw on branches, and engage in activities that help wear down their beaks in a natural way. However, in domestic environments, the bird often does not have access to sufficient stimuli to perform these activities, which can result in a beak that grows beyond normal. The absence of appropriate chewing toys, such as untreated pieces of wood, cuttlefish bones, and other safe materials, can prevent natural wear and tear of the beak. Toys made specifically for birds not only entertain, but are also essential for maintaining the health of the beak by preventing overgrowth. In addition, the lack of a varied diet that includes hard foods, such as seeds and grains, offered as snacks, also contributes to the lack of wear and tear. The beak of cockatiels is designed to break down and grind food, and if the diet consists only of soft food, the beak may not wear down as it should. Therefore, ensuring that your cockatiel has a variety of toys and foods that promote natural beak wear and tear is key to preventing overgrowth. Another factor that can be causing this overgrowth of a cockatiel's beak can be oral health problems, such as infections, trauma, or abnormalities in the structure of the beak. These conditions can interfere with the natural wear and tear process, resulting in a nozzle that grows irregularly or excessively. Bacterial or fungal infections, such as candidiasis or sinusitis, can affect the area around the beak, and in some cases, cause inflammation and deformities we will talk about in more detail throughout the video. Physical trauma, such as blows or falls, can also alter the way the beak grows. If the cockatiel hits its beak an object, it can cause fractures or cracks that, when healed, can result in abnormal growth. In addition, congenital problems such as deformities in the nipple at birth can lead to disproportionate growth throughout life. These oral health issues require specialized care. A veterinarian will be able to evaluate the cockatiel's beak, identify any potential infections or trauma, and prescribe appropriate treatment. Depending on the case, treatment may include the administration of medications, dietary adjustments, or even manual wear of the nipple, performed by a professional to correct overgrowth. Congenital beak deformities of cockatiels represent a condition in which the bird is born with structural anomalies that affect the shape, size, or functionality of the beak. These deformities can range from slight irregularities, which have little interference with the bird's daily life, to severe deformities that compromise its quality of life. In many cases, these anomalies result from genetic mutations inherited from parents or from problems that occur during embryonic development, such as nutritional deficiencies, exposure to toxins, or infections that affect the embryo in critical stages of growth. These deformities can manifest themselves in several ways. The beak may grow asymmetrically, with exaggerated curvatures, or the two jaws, upper and lower, may not align correctly. When the upper beak grows too large in relation to the lower one, for example, the bird may have significant difficulties cutting and handling food, which is essential for its nutrition. Likewise, a malformed beak can impair important activities, such as the behavior of pecking objects, sharpening one's own beak, or even performing personal hygiene. Cockatiels with these conditions may face additional challenges in their social and behavioral interactions, as the beak is a key tool not only for feeding but also for communication and advocacy. In more severe cases, disproportionate beak growth can even lead to ongoing pain or discomfort, affecting the bird's willingness to feed or interact with its environment. Thus, it is essential that tutors pay attention to the development of their cockatiel's beaks, seeking veterinary advice whenever they notice any sign of deformity or difficulty in the bird. Therefore, it is important that you are always aware of the health of your cockatiel's beak and seek veterinary help whenever necessary. Depending on the case, treatment may include medications, dietary adjustments, or even manual nipple wear, done by a qualified professional. So always be closely watching the development of your cockatiel's beak, looking for signs of deformities or difficulties. Early diagnosis and proper management are essential to ensure that she has a healthy and happy life. And of course, I maintain a balanced diet, offer toys for the wear of the nipple, and be aware of any sign of health problems. After all, I want your cockatiel to have the best quality of life possible. So, as you have seen, cockatiel beak overgrowth is a serious problem, but one that can be prevented and treated with the right care. Now that you know the main causes, how about taking the next step and finding out how to make your cockatiel even healthier and happier? If you like this content and want more valuable tips on caring for your birds, you already know. Subscribe to the channel, activate the bell so you don't miss any new videos, and of course, leave your like. This helps a lot in publicizing our work and allows more people to learn how to take care of their cockatiels with affection and responsibility. And if you know someone who also loves these amazing birds, share this video. And now I want to know, where are you watching this video from? Leave your opinion and the place from which you speak in the comments. I love reading each comment and interacting with you. Don't leave yet. Right on the screen, the link to an upcoming video that you need to watch will appear. In it, you will learn essential tips to identify signs of health problems in your cockatiel and how to ensure that it lives many years by your side. Don't miss it. Click now and continue this journey of care and love with your cockatiel.